Well, hello there, everybody. My name is Tiffany. Thank you for joining us for our community broadcast this afternoon. We are waiting for a couple more folks to sign on. So in the meantime, I'm going to go ahead and share in the chat a link to RSVP for our next broadcast. As Mark will note in a bit, we are going to start doing these monthly to connect with you, keep everybody up to date, and have a chance to hear from you and answer any questions you might have. So if you've attended before, the format will be the same for today's broadcast. We're gonna have a series of updates, hear from a lot of special guests from within and outside of the organization, which I just had someone arrive, so I'm going to promote to panelist. And then at the end, we'll address any questions that come through the chat or through the Q&A, as well as some questions that we received in advance. We are coming right up, it's 3 p.m. now, and in the spirit of starting on time, I think I can go ahead and ask Mark to turn his camera on.
Hello, everybody. Thanks, Tiffany. And thanks everybody for joining us this afternoon. As Tiffany mentioned, we are doing these community broadcasts now on a monthly basis. We started them about 3 months ago, trying to find creative ways to stay connected with all of you. And we have found these to be a really good way to do it. We'll get this done in 30 minutes so you have a sense of what's going on in the Chrysalis world. Today, we are really fortunate to have a number of special guests with us. We're going to have a chance to meet Kendra Jones, our Senior Operations Manager with our Roads Program, and Michael Gabbert, a Supervisor in the Roads Program. They're going to be joining us from our downtown office, so we're going to be testing the limits of our technology here because we're doing remotes. We're also going to have a chance to speak with Kelly Bruna, who is the CEO of the National Health Foundation, and one of the operators of Project Roomkey sites around the county. And she's going to be joined by one of our clients that is working at her site, Moretti Davis. So you get a chance to hear what Project Roomkey is all about and the role that Chrysalis has been playing in that. But I'll kick us off with just a few opening remarks before we get on to talking about our roads program. The first thing I think it makes sense for us to talk about is the homeless count information. So many of you probably have been following this. If you're a follower of Chrysalis, and I am pretty sure you are a follower of everything that's going on with homelessness in our city and county. And so you probably saw these statistics that showed that unfortunately we've seen another increase in homelessness based on the point in time count that was done this winter in LA County and the city. Almost 13% in the county and just over 14% in LA City. And this was done, by the way, in the January, February timeframe. So it was before COVID. And we know that that is only going to make the situation worse. Now, when you start to get underneath these numbers and what drives it, we're actually, last year, we housed more people than ever before, folks that were housed in the various efforts that are being supported by Measure HHH across the city and county. Nearly 75,000 people were either housed or left homelessness last year, but unfortunately, 83,000 became homeless. So you can think of it another way. We're housing 207 people on average every single day, but we've got 227 people that are becoming homeless every day. So there's that imbalance. This is a complicated issue, as you all know. There are many causes of homelessness, but the key thing is we just don't have enough affordable housing in Los Angeles. Renters in LA County would have to earn $42 an hour to afford the average asking rent of $2,200. So clearly we have work to do to not only house the folks that are on the street, which we've got a really good story about Project Roomkey that we'll talk about in a little bit, but also to just bring down that cost of housing, increase the supply in general. Now, when you talk with folks about what caused them to fall into homelessness in the first place, there's some really interesting and very clear statistics here. The number one cause for folks that fell into homelessness for the first time, 59% cite economic hardship. And in the biggest cause of that is the loss of a job. So we know that the work that we do here at Chrysalis is as important, in fact, more important than ever, to help getting to the root causes of solving and addressing homelessness in our community. Now, no discussion of homelessness would be complete without talking about the structural racism that is affecting our country and our community And here, yet again, we see an illustration of it. This chart breaks down the proportion of folks by various racial groups in terms of what percentage of the homeless population does it represent and what percent of the overall LA County population is it. And the point that I'd like to highlight is the percent of the homeless population that are Black versus their representation in the population. It's basically a 2.5 times overrepresentation of Black folk in the homeless population. The Los Angeles Homeless Services Authority, who produces the annual report and conducts the study, had a task force that has been looking into this issue for 2 years. We've known this has been a significant issue, but this just really highlights it. You know, all of us over the last few weeks have really had to do a lot of soul searching and think hard about racism and injustice in our communities and in our society. Chrysalis is no exception to that. When we're talking about unemployment, homelessness, incarceration, the impact of COVID-19, people of color and Black people in particular are disproportionately impacted. These are issues that go to the core of our mission at Chrysalis, and we've been having many conversations as a staff and as a board about what we need to do more than ever in these areas. In fact, we hope to dedicate a good chunk of our next community broadcast to talk about some specifics there. And we're happy to talk about that further in the Q&A later in the program, but I just wanted to set the stage of that and share that information with you. So a couple of other updates before we turn it over to Kendra and Michael. As we've been reporting since we started these in March, we continue to offer virtual services to our clients by phone, by text, by email, by video. And to date, we have had meaningful case management conversations with over 3,000 of our clients. That's not just one email going out. Those are actual two-way conversations between our staff and our clients, really working on meeting them where they're at. We've also opened up to accepting new clients into our system. Even though our doors are temporarily closed, we've been able to assess and work with clients that are new to the Chrysalis program. And over the last month and a half, there have been 350 assessments, new clients that have joined us. And we are also helping folks get jobs. Yes, there are jobs out there, and nearly 300 of our clients have found new permanent employment through the help of our program. But as we'll talk about in a moment, our social enterprises have really helped a lot of our clients stay employed, keep income going, and also just have that sense of dignity and pride that comes with working. Last Friday, 476 of our clients received paychecks, and that number continues to go up week by week. You know, a big part of that is our roads program. We're very proud of this partnership with the California Department of Transportation, the Butte County Office of Education, and the LA Mayor's Office. It's been a really successful program for us, and it's successful because we have great people like Kendra and Michael that help us run it. And so I'd like to turn this over to Kendra to tell us a little bit about what's going on with roads.
Yeah, hi everyone. Like you mentioned, I'm Kendra Jones, one of our senior operations manager here with Roads. And you know, the great exciting news we have to share is that we are back in operations. We were able to launch a successful first week last week. So I don't know if all of you were on that broadcast beforehand, but my colleague Kelly, our senior program manager of Roads, did mention that we decided to take a pause on deploying out our crews. And that decision really was based on, at the moment, us really not having a clear sight of to how we can maintain safety in just our normal operations. So during that time we took off, we really took a time to focus on each piece of our process just to make sure that we can kind of infiltrate safety at all costs. But just in case you're not actually aware of what Roads is and you know what that means, let me give you just a bit backstory on our department. So Roads is actually one of the divisions of our social enterprise that employs our Chrysalis clients that have been impacted by the justice system. So it gives them the opportunity to link to highway maintenance jobs through our partnership with Caltrans and Butte County Department of Education. So last year in total, actually, our crews were able to collect over 300,000 bags of litter and work alongside Caltrans crews doing different type of landscaping duties. And in total, we have about 10 crews. So they're all deploying from various sites of Caltrans yards from Long Beach, LA, and now Orange County. So now that you kind of know us, right, this first week back has been really exciting for us. And like I mentioned, a lot of it was just re-examining what our processes look like. So we were able to relaunch this past week with an entire updated policy and guidelines in our response to COVID-19. Things included in that, a lot of that was actually providing training for our supervisors to be able to do those symptom assessments of themselves as well as the crew members before anyone got in those vans and decided to deploy out to the work sites. We've had to tackle really creative ideas and things like color coordinating our tools to make sure cross-contamination didn't happen. We've created an entire staging process to make sure that our clients can complete social distancing, even if all they're doing is just clocking in for that day. But a big part of that shift that we're in right now in our response to COVID-19 is taking that crew size down from a crew of 8 down to now only 2. So this decision was really rooted in our need to maintain social distancing, even in the van. So to be able to max out at no more than 3 clients per van, and we'll work to get to that number in the weeks to come. This allows them to keep their 6 feet of distance, even just transporting back and forth through the different work sites in Caltrans yards. For those clients that maybe aren't ready to get back to work so soon, we've been lucky enough to still be able to offer them paid training, which is what we call telework training, that are really rooted in the topics that they'll need for roads, but also a lot of skills that they'll be able to put on their resume down the line. And I'm sure kind of Kelly mentioned a little bit of what our telework trainings looks like, but as an added note, the knowledge checks that we offer with it, so it's kind of like a quiz-based process, was created by our road supervisors to ensure that the clients got a full learning of what the material was. And with that, I will say a big piece of us being able to come back so smoothly has been linked to our road supervisors. We definitely could not do it without them. So I wanted to give a moment and introduce you to one of them, our road supervisor, Michael Gabbert. I'll ask him a couple of questions now.
Hello.
Hi, Michael.
How are you?
Good. So go ahead and introduce yourself.
Okay, well, I'm Michael Gabbert, and I'm actually live right here at the Chrysalis downtown Los Angeles Center. I'm a road supervisor with Emperor Crew. I actually started as a client a little over a year ago, and I worked my way up to lead and then eventually to supervisor. And needless to say, the roads program at Chrysalis has really made a positive impact in my life.
That's great to hear. So I know I was lucky enough to shadow you and your crew our first week back, but tell me, what did it feel like getting back out there this past week?
Well, it was good. I was a little nervous because of of course, of the pandemic and of the response maybe the crew members might have to the new steps that we take for safety. But all in all, it was really great. It was great to be back to work, and the crew members were positive and embraced everything with really positive attitudes.
That's great to hear. So in terms of like feedback from the crew members, did they give you anything specific?
They're just really happy to be back to work. To be honest, I think that it was kind of an eye opener for everybody, you know, not just them, but for everybody. And so they jumped right into it. They like being back there and they like working. They appreciate it.
Yeah, and I know during our time off with those telework trainings, I know you were able to provide just like those phone check-ins to kind of keep the rapport going. So hopefully that helped bringing everybody back smooth. But tell me, what is it like working with the crew of 2 now instead of 8?
It's bittersweet because of course the productivity isn't going to be as high with only 2 crew members compared to 8. But the positive part of it is that I get to interact with them more individually and personally, and just really build them up in the training that they need to become employable, good employees.
That's great to hear. And I know it's very appreciated from clients. Being a former ES and now stepping into this role, that's all I hear is that people piece that we're allowed to offer. But thanks so much, Michael. Mark, I'll actually go ahead and hand it back over to you.
Thank you.
Thank you, Kendra. Thank you, Michael. Really appreciate you joining us this afternoon and taking time to do it, being masked up properly. Much appreciated. Michael mentioned that he's on the Emperor crew. Each of the crews that we have working roads are named after a butterfly. I didn't know there were so many different species of butterflies until we started this program. I didn't know there were emperor butterflies, but there you go. Really important work, and we are so glad that you're back out there and doing that important work and doing it safely. Okay, let's transition to talk about another important part of our program at Chrysalis, but even more important for the community. So Project Roomkey is the umbrella term for the process of trying to house our most vulnerable community members throughout the state of California during this crisis. And from the state on down, different localities have tried to do it in different ways. Here in LA County and Orange County, we've had a really successful program. In fact, I believe as of Friday, there were over 4,000 individuals that have been placed into different temporary living situations, primarily in hotels in LA County, and in Orange County, over nearly 700 have been placed. These programs are run in partnership with nonprofits, service providers throughout the county, and one of them is the National Health Foundation. And we are really fortunate to have a great relationship with National Health, and my friend and the CEO of National Health Foundation, Kelly Bruno, is with us. And Kelly is with one of our clients who is assigned to this particular Project Roomkey site, Moretti Davis. We have about 60 of our clients each week that are working in 14 different Project Roomkey locations. But we thought this would be a great opportunity to hear what is going on in the field. Thank you guys so much for joining us today. Take it away.
There we go. Can you hear us now?
Loud and clear.
All right, I'll let you go first.
Microphone check. Well, Kelly, since you're the foundation, I thought that perhaps you would at least lay the road.
Oh, okay.
Or pave the road.
Well, thank you for having us. And it's exciting to be here alongside one of the guests or one of the clients of Chrysalis. That we are so excited about the partnership with you all. And it has been just incredible opportunity. National Health Foundation has been running this Project Roomkey here in Fairfax District for about a month. And we are very fortunate to have 12 Chrysalis clients working with us from the beginning. And just an absolute phenomenal part of the program. They're serving really as, I would say, the foundation of the program, providing services and assistance to the guests that are here. We have 91 rooms. And so the Chrysalis employees or guests, they help us with meals, they help us with whatever the guests may need. They're doing logging in the computer, of course, because of all the wonderful FEMA requirements that we have. But they're really the core of the program insofar as the ones that really interact with the guests the most. We've always had a great relationship with Chrysalis and your organization, Mark, and we're so fortunate to work with you. But this is the first time we've had so much interaction, and I cannot say enough positive things about it. In fact, I would say that it has completely altered National Health Foundation's way in which we will be looking for new employees moving forward. I know we also have another employee that started at one of our other facilities that was hired on. So we really feel this relationship is just incredibly strong. And this Project Roomkey here, so important when it comes to serving individuals experiencing homelessness that are more susceptible to the virus because of an underlying health condition or because of their age. And so the program here is also very important. I'm not going to say too much more because you are the star of the show. So I want you to be able to talk a little bit about what's going on here and your role here.
Hi, how are you? My name is Moretti Davis, and I'm a client of Chrysalis. And I kind of came in without a lot of expectations. And this being my first Chrysalis assignment. You know, I had been working as a result of some of the direction that I got at Chrysalis and my employment specialist, Elena, just getting me back on the horse, that I was blessed to be able to get this position to be a guest service attendant over at the Atlanta Hotel, one of the Project Roomkey sites. And this has been a very empowering experience, not only because I can connect on the empathy level because I've experienced homelessness myself, but to be in a position of empowerment, to be able to help people out and have people come up to you and tell you that they don't know what they would have done being in their medical situation and the homeless factor if it wasn't for this particular project. And, you know, 92 people, that speaks volumes, just the magnitude. You know, the relationships have been the best part about it, getting to know the patients, their dogs, some of the service animals. And we try to give them VIP treatment because a lot of these people have had some setbacks. Well, like myself, I mean, there's a lot of ups and downs emotionally involved with, you know, homelessness and that whole thing in general, that whole, I guess you could call it like an encyclopedia of issues. But it's been great. I've learned quite a bit from some the program heads. I think all of them have superpowers at NHF. Just a gift that they bring to the table, and it's been a great learning experience. Thank you.
You're welcome. So like I said, we feel so fortunate to have so many of the Chrysalis employees here with us, and really look forward to a very long relationship at all 4 of our sites. You know, this site is just going to be up for a few months, but we do have 3 other sites, and we're looking forward to a very long and prosperous relationship together. And I really cannot say enough that this project would not be possible without the partnership with Chrysalis. We have 31 temporary employees working here, and Chrysalis represents 12 of them. So you're almost 50% of the workforce here at the site. So we're just very appreciative of the partnership and look forward to it continuing.
Can I chime in for 1 second?
Chime.
I just want to thank you too, Kelly, for involving. I mean, it wasn't a thing. We all thought we were just going to be wiping stuff down all day. And then, you know, we had an orientation where we went over some of the like the foundations, you know, the different sort of qualities that they want their employees to have, and you know, focusing on empathy and people and so forth. And that was even empowering in itself, but just to be able to be a part of it, an active part of it, building something up that never had been built before. You know, we thought we were just going to be like the sort of like the hired help, the hands, but they've really made us an integral part of this whole organization, even including us in one of their staff meetings. And it's been great.
Thank you. That means a lot.
Marite and Kelly, thank you both so much for taking the time out of your workday to share that with us today and talk about this really, really important work. You know, as we think about who is at most risk of COVID-19, I was just reading something this afternoon that was speaking to the difference in how many folks experiencing homelessness have been impacted by COVID-19 in Southern California versus some other municipalities around the country. And while one case, one death is too many, we certainly have done better than other cities and counties. And I think a big part of that is this project. So thanks for your leadership in that. Well, Tiffany, I think we are at that part of our broadcast where we can answer some questions, or do our best to answer questions that
Yes.
folks might have.
Absolutely. So I'm going to ask our panelists to come back online and request that they turn their cameras back on. We do have a few questions we received in advance. We'll go ahead and address those. And then with any extra time this afternoon, we can address any that come through the chat, but otherwise we can also sign off a little bit early if that's the case too. So our first question, let me just pull up my notes. That given some of the updates with the roads program, we had a question come through about what are the procedures that you have put in place to help protect the workers and the crews. And so I wanted to see if Kendra and Michael could help speak to that. I'll just ask you guys to unmute if you can.
You want to start us off, Michael?
Okay, well, I'm sorry, what was the question again?
No problem. The question was, what are the procedures that you've put into place to protect your workers?
Oh, okay, well, for starters, we social distance in the van, keeping them every row farthest away from each other. We spray the COVID-19 spray over every touchable surface. We set up cones to social distance as they are waiting for setup. And we've given them all the, well, I don't think masks are considered PPE, but we've given them masks, sanitizer, their individual Ziploc bags for their face gear and their glasses, just to keep everything from everything else. And then not only that, but we've given them the training and pretty much just the awareness of what the virus does and the things that they need to implement, not only at work, but I mean, they should be doing it in their personal life too. That's what we're hoping for to stop the spread.
Yeah, and to just kind of add to what Michael was mentioning, that was really at the forefront of how we relaunched. A lot of it, we wanted to make sure that we saw it from the client's view. So offering things like our information card of one side being how to stop the spread, the other just testing sites that they can go to if things happen. Like I mentioned, a lot of it is going to be our assessment that we do at clock in, just to make sure that everyone is healthy, and we give them different options if ever they decide that they need to go home that day. And Michael went through a lot of the day-to-day procedure that we're doing out at the work crew. They're taking the extra time to social distance and stage. They're taking that extra time to disinfect, as he mentioned, our trailers and our tools at the end of the day as well, and just continue with our touch points. So a lot of it is just making sure that our staff and our clients have that knowledge of how to protect themselves and function within that.
Thank you so much, Kendra and Michael. All right, our next question is for Mark, and it is, are there any updates on when you will be reopening your centers to clients?
Great question. First, we have a new way of looking at this, and specifically, I'm trying my best not to use the reopening word, because the fact is we've been open. We've been open since this all went down on March 16th. From the client services standpoint, we've been providing virtual services. And from our businesses standpoints, most of those businesses continue to operate maybe in slightly different formats. So what we're thinking about and what we're moving towards is what we're calling additional in-person services. We're really drilling down hard on why is it that we need to be open, who needs to be there to deliver those services, and how can we be most effective and keep everybody safe. So one of the biggest things we've heard from our clients is access to technology. The digital divide is real. And so what we'll begin to do over the next few weeks, probably in early July, is to begin have limited capacity in our offices to allow clients to come in to use our computers, and through some digital kiosks connect with our case managers wherever they may be. But we won't be going back to having traditional classes and a lot of one-on-one meetings as we did prior to all this going down. But we will be able to meet clients where they're at and be able to provide those important services and keep everybody safe.
All right, we do have a couple of minutes left. I think, thank you for that note, Amber. I think we're about to wrap. Does anybody else want to chime in with any questions or any other notes to follow or close us out? We might just have gotten a couple of minutes back in the day.
Hey, you know what? I did notice one question from one of the members of our audience. The question was, do your programs address system injustices in Los Angeles in general? And that's a great question. I think any of us that work in this community have to ask ourselves that really hard question, or it's not a hard question, it's just an obvious question. Our population that we serve actually looks a lot like what was on that chart that I showed earlier about those that have been impacted by homelessness in Los Angeles. So we primarily serve communities of color. And in order to help those folks get back into the workforce, we have to push the edge. We have to push the edge with employers, with policymakers on things like minimum wage. There's a whole host of issues that historically we've been engaged in. And I think the question for us as an organization is, how do we continue to push that even harder at this moment? Can we take can we take this opportunity to change dialogue with other folks in our networks, supporters, policymakers, and employers to push this to an even bigger degree? Because I think that's what our community demands. So we're looking at that really hard internally, and I'm confident we're going to make some progress on it. The time is now to do it. Great. Well, I see that it is 3:30, and this is the first time we've done an afternoon version of this. We have pretty good attendance today, so maybe we'll experiment with time of day to see what works best for folks. But thanks to all of our panelists for joining us today. Thanks to all of you in the audience that have been supporting our work and talking to your friends and neighbors and employers and all that kind of stuff about it. That's what makes our programs work. And Tiffany, thank you once again for managing our program this afternoon.
My pleasure. Thank you to everyone.
All right. Bye, everybody.